Welcome to Omaha, Nebraska. Nestled along the Missouri River, Omaha is the 42nd largest city in the U.S. and is home to over 470,000 people. Like many cities, Omaha faces issues with health disparities and social inequality rooted in a history of structural racism and oppressive systems. Black folks make up about 12% of the population in Omaha and yet experience some of the worst disparities in health outcomes. Here are some Nebraska stats that we see reflected in Omaha. Almost 1 in 4 Black women receive inadequate prenatal care during pregnancy. Nearly 1 in 3 Black women had a low-risk birth yet delivered by cesarean delivery, meaning they were giving birth for the first time and pregnant with a single full-term infant in a head-down position. 1 in 7 Black babies are born preterm before 37 weeks gestation. And Black babies have the highest rate of death in Nebraska before their first birthday. One of the leading causes of infant death is preterm birth. Multiple reports, studies, and news articles have highlighted the benefits of Black community doulas as one of the solutions to improve the health of Black moms and babies and prevent dangerous outcomes. A doula provides information and emotional and physical support before, during, and after childbirth. Research has shown that continuous support during labor reduces the risk of C-section and use of pain meds during labor, reduces risk of preterm birth, and helps to address social drivers of health by connecting clients to resources, while also increasing satisfaction with birth experience. All birthing folks can benefit from supportive doula care, no matter their education or socioeconomic status. Even doulas may use a doula for their birth. Anabelle is a doula serving Omaha and gave birth to her first child earlier this year.
That's funny because actually I wasn't going to hire one. I was like, oh, I can doula myself. I figured I had been doula for long enough. I could figure it out on my own. But then I got to like 15 weeks and I had all these questions that I knew the answer to, but I felt like I was insufficient for myself because like I could answer my own questions, but it didn't ease my concerns. I spent a lot of time looking at websites, like figuring out models of care, getting on like social media and checking like people's reviews and stuff. And in the end, I decided to go with my friend because they honestly had the best reviews and because they were culturally competent. So it was important to me that I have somebody in the space who is the same skin color as me, because I knew my care team, my medical care team was white. So I wanted somebody who looked a little like me in the space. So that influenced my decision too. But there would be times where like I'm my own worst patient or client because I was like, nah, I'm fine. I don't need to go to the hospital. Like, this is fine. And my doulas were like, actually, maybe you should go get checked, which without my doulas, I probably would have had my baby way too early because I was not going to go to the hospital when I was having contractions. But then Angela was like, Anabelle, you're 34 weeks. You're not supposed to be having contractions. I don't care that they're only 10 minutes apart. You shouldn't be having them. And so then I went to the hospital and they were like, yeah, this is preterm labor. And they were able to stop it and give me steroids and make sure the baby was okay. But yeah, I wouldn't have gone if it hadn't been for Angela. So they were never annoyed with me. They always answered my texts and my calls. I am one of those people who utilized the 24/7 support option. So and I was not expecting to be that person. So I would say that was the greatest benefit, was just always having an ear and never worrying about being a burden or anything like that, because I knew that they were working and this is their job. As a parent, it's really important that you pick the person who's going to be in your sacred space. And I feel like if I hadn't picked the right person for me, I wouldn't have been able to have the freedom to feel like I could tell them all the things. And because I feel like that was my biggest benefit to hiring a doula, was just having a friend. I feel like you really have to pick your friends carefully.
While Black doulas are celebrated as key community workers, what does it look like for Black women to reclaim this role in Omaha and to take on the work of building equitable access to doula care for the community around them? Angela is the owner of Downtown Doula of Omaha and has been providing doula services for 3 years. Alita has been a doula for over a year and is the owner of Doula Companion and co-founder of the Omaha Black Doula Association. They shared their experiences working in Omaha.
I think that when I first started as a doula, I only knew of one or maybe two other doulas of color. And it was really hard to get my foot in the door and understand where I fit. And I truly didn't feel like I did fit anywhere. That was hard. But once you find your community, your village, your people, it all just kind of comes together and we support each other. And that's really what makes it work.
I would say it's changing. It's changing. Initially, heck no, at all, not at all. They're like, who are you? Who do you think you are? No, we don't need you. Goodbye. That type of thing. But now it is starting to change. They see that we're not the enemy. Like we're crossing that divide. We're filling that gap. And we're saying we're part of the team. We are trying to co-create something amazing here, and it is the birth, and we want it to be successful, just like you want it to be a success, and you don't want to have any write-ups or being reported or whatever. We want that too. We want that for you. We want that for our moms. And so now it's starting to change, and they really are looking at us different and not looking down at us. They're looking at us at eye level, and they understand that we're coming prepared and educated, and that we're also preparing and educating our clients. Trust, like building that trust, that is huge. Like in our community, it's like, who, if they're not connected to you somehow, like I went to school with your cousin, I knew your mother, went to church with your auntie or something like that, they're like, who are you and why? Like, why do you even care about me? Like, are you really genuinely invested in this? Are you just looking for something? Are you looking to just be in my business? That type of thing. So the trust is a huge thing. So once we get that built, then it's all of the other systematic things that happen. They don't have transportation, they're malnutrition, they don't have the education that they need, and being able to supply all of that in such a short period of time, it's like we're trying to give lifelong lessons that we should have learned when we were younger, including myself. We're trying to smash that into 9 months or 6 months before this baby is here, and then they have all these other life lessons that are going to be hitting them in the face.
Insurance cover all doula services. If all insurances would cover doula services and we could get out there and teach people what doulas do and why our work is so important, then I think everybody would have a doula as soon as they found out they were pregnant. It would be find your OB, find your doula, and figure out who your pediatrician is going to be. And that should be like a little package deal. Everybody should believe that that's what they should do.
Even if there was more funding available for families to pay for the cost of doula care, there is still work to be done to provide Black women with access to the types of training they desire to enter the doula field and to build their business savvy as they embark on this journey as entrepreneurs or join in collaborating with existing doula programs in the Omaha community. Samaria Patrick is being mentored by Alita and is preparing to start her training as a doula and begin work in Omaha. She shares her thoughts as she plans for her future.
Just the cost of training is like, oh my God, they might not want to pursue it because of the cost. So, we're not having as many active Black people that are entering this career field because of the cost of things. So just me personally, that's what I'm looking at. Once I received my scholarship, I was through the roof. I couldn't stop smiling for days. But for me, having a mentor is the biggest help, because even though, I know a lot about babies, but I don't know, everything that I want to know or need to know about going into this career field. And that mentor has a lot of experience, to help me out, and a lot of wisdom and knowledge and, tips and tricks that, whichever training program I go into, they can tell me stuff, but, it could be a little bit different than what I'm learning from a mentor. So I think it's, wise to have a mentor in place.
Mentorship and partnerships are crucial for Black doulas to have that collective power and impact to enact change in their community. We see that in our neighboring states with the Iowa Black Doula Collective, Uzazi Village in Kansas City, Missouri, and Jama'a Birth Village in St. Louis, Missouri. These groups and organizations have created training opportunities, received large grants, and developed programs to support Black birthing families, and Omaha is not far behind. In the middle of the COVID-19 pandemic, Alita and her best friend Asia went through doula training together and launched the Omaha Black Doula Association. They have hit the ground running and connected with partners to provide resources for the community. This has included a community garden in collaboration with YBI Academy, a diaper drive in collaboration with nonprofit A Mother's Love, and with funding from Ivy Black Girl, they held a community baby shower. What an eventful first year. There's a slogan in Omaha that we don't coast. And when it comes to supporting the health of moms and babies, our Black doulas are no exception. Both Angela and Alita have plans for more programs and also ways to support new doulas.
Hopefully next year, I want to get very deep into childbirth education. I'm also starting to think about doing a mentorship program for new doulas, helping them get their business started, helping them with websites and how to sit down and do interviews with clients and keeping up with your paperwork and invoicing. So I'm thinking about that as well.
Bigger, better, more quality services. So more training, like I said, advanced training, more doulas, as many as possible that we can get involved and get their certifications, more mentorship. And we did already do one baby shower. We plan on doing another bigger, better one next year in March, which is being funded by Ivy Black Girl and Women's Funds. But and then just more events, literally like every single month. So like I said, bigger, better, and just better quality than what we did this year. This year was off of the like whim and like just trying to get in there and get our hands dirty. This year will be a little bit more organized and purpose driven. So
the lived experience of being Black in Omaha and in the United States has many systemic challenges designed to discriminate and destroy. Yet birthing people continue to show their power and can feel joy in the sacred space of their birth as they bring a new life into this world. Having access to culturally relevant doula care is one piece of a multifaceted solution to address this complex issue of eliminating maternal and infant health disparities. Their practical assistance of friendship, information, comfort, and support reduces adverse outcomes and improves self-advocacy and satisfaction with the birthing experience. Their work is impactful and life-changing, and that in and of itself is one of the best rewards.
These mamas get educated and they realize that they have a voice. When they get in those rooms and they be speaking up for themselves, I'm like, get it, girl. I'm just gonna sit over here and cross my It makes me so happy to know, like I said, that they found their voice and that they use it and they're able to speak to these nurses and doctors on that same level. Like, I know what you're talking about. And yeah, I already did my research and this is what I really want to do. I hear what you're saying, but this is one of my options that I chose.